Hello, everyone, and welcome to our webinar today. Today we're going to talk about New Year's resolution for 2022, improving the patient experience. My name is Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions, and I'm joined today by our CEO, Russell Hendrickson. Welcome, Russell.
Thanks, Scott, and thank you, everybody, for joining us today. It's great to have you here. And we work to help our clients get the right information and be able to visualize that, present it, and really manage their performance on their data.
So for those of you who joined us for last month's webinar, we talked a little bit about blending data and the ability to take data from like the financial system and the scheduling system to blend it together to tell the whole story. And one of the things that we felt was important to blend in as well was data from the patient satisfaction surveys that you may be getting. Again, just to really get a full picture of what's going on within the practice.
One of the other key topics that we talked about in our November webinar on blending data, we even dug down into physicians' productivity, and we were showing, the focus being around physicians and work RVUs, and then looking at their coding levels and how long it was taking to get their charges billed. Of course, looking at their patient access metrics, and then again in the webinar, we talked about the importance of being able to look at and make sure you're also focused on patient satisfaction data. And this is an example of an interactive dashboard where we were doing that. But we really felt it was important to bring a webinar to the table that instead of focusing on sort of the business aspect, we would focus on the patient experience and look at the data from the other side, which is what's going on, how are patients feeling about what's going on in our organization, and make that the primary focus of our topic.
Yeah, so we want to start today by really examining what we mean by patient experience, because really it is a lot more than just the patient satisfaction scores. Patient experience is what happens from the time that the patient feels something like they need to go to the doctor, and so they call in to try to schedule an appointment. Once they get there, they register and give all the information. What happens during the visit itself, what happens in their interactions with the staff, what happens afterwards with how easy it is to get their bill, to pay their bill, or their denials, which throw things off, which can be a real dissatisfier. Are there other issues which catch them off guard or by surprise? All of these things can really impact the patient experience. So that even if you have the best of outcomes, even if you're doing a good job actually caring for that patient, their whole experience may be tainted a little bit because of one or two little interactions along different parts of the revenue cycle or the visit cycle that occurs that can really give them less of a high quality, excellent patient experience that they would expect. So why do we even really care about things like this? Well, obviously, if we're improving our patient satisfaction and our patient experience, if patients are having a good experience with their interactions with our providers and our care teams, obviously the loyalty that they're going to have with the practice is going to go up. And that's something that we definitely want to see. Their satisfaction is going to go up as well, which is going to help us internally determine our quality of care and how we're performing with regard to providing excellent care to our patients. But in addition to that, when patients are satisfied with the care that they're provided and when they feel like they're getting a good experience with their providers, they're going to go back to their primary care physicians if they saw one of our specialists, and they're going to tell them how they had a good experience, which is going to increase referrals coming in from the primary care community that's out there. And in addition to that, we've got to look at the online reviews, which is how a lot of people are now going and determining where they're going to receive their care. That really our presence is out there, whether we know it or not, whether we like it or not. There are online reviews everywhere of our practice, and we want to make sure that those are as positive as possible, and we don't want one thing to really throw those off.
Yeah, there's an old business adage that says, it's 5 times as expensive to win a new customer as it is to keep a current customer. But I really think that applies to patients and their experience within a medical practice. If they should have a really bad experience or decide to leave, may not be easy to win those patients back. Traditionally, people talk about patient experience and they think patient experience is just what's in your patient satisfaction data. And they might just be looking and saying, well, overall, we're getting good ratings, so we know we're doing well. Or probably the second most popular metric to look at would be, would the patient recommend the group? So if these two are good, then we're doing a great job within our practice. But if you're familiar with what's in that patient satisfaction data, the survey data, and we're going to look very closely at that today, there's a whole lot more questions and areas that the organization and the patient experience is measured. So we really feel it's very important to be looking at that data and understanding what's going on in your practice from all sides. And so if you look at this little chart, little diagram in the middle here, if you look at it from the left, you can see there's 4, but if you look at it from the right, you see there's only really 3 posts. So it's really important to understand what's going on and kind of look at it from all sides.
Yeah, and I think really when we're trying to balance patient perspective, we need to kind of balance multiple perspectives and multiple perceptions that are out there. And we need to start with the patient and understand what's going on with them. They may be having some difficulty getting in or getting through to schedule an appointment. They may be having a negative experience with a staff that may have just been a one-time thing with a particular staff member, but that perception will kind of hold throughout the entirety of the visit. And then, of course, what happens with their responsibility and what are they seeing on their side when it comes to their responsibility for the payment for the services that are out there. And so we can look at that from a management side of things and say, well, this is what we think is going on that side as well. We may work in a call center and we know, we hear all of our representatives out there taking calls and scheduling appointments. It must be very easy to get through and do it because we hear a lot of it going on, but we're not necessarily seeing that other side. We may work in a clinic and know that our people are good people and that they do a good job for the most part, and we're not seeing the 1-2 little interactions that may not go the way that we would hope. And so that perspective needs to be balanced in there as well. And then, of course, there's always what's really going on. The perception is one side, but our analytics are going to tell us what's truly going on within the practice. And so balancing all 3 of those is what's really going to tell us and give us the right side of the truth that we're trying to discover here.
Yeah, so if we were to dig into that one area and say, what do patients want? What are patients really looking for, right? And, I would say at the top, certainly when I go to the doctor, I want a good outcome, right? Whatever the problem is that I'm presenting, I hope it gets fixed or the pain goes away, or it's a simple, take 2 aspirin and call me in the morning. But the reality is that, outcomes is just a piece of the puzzle. And I think, healthcare and the patient experience has really evolved quite a bit over the last, 10 years. So it's not just about outcomes, but it's about, did we have good communication? Did we feel like we were heard? So quite a bit of different areas here. Scott, what would you say, in terms of what are patients looking for, beyond outcomes and probably communication?
Yeah, well, I think communication, obviously, like any relationship, is the key. But they want to make sure that they're being heard as a patient. When you go into the doctor and say, my knee hurts, and all of a sudden they're looking in your ears and your eyes, you're not being heard. They're not focusing on the problem that's at hand. They want to get it done quickly. They want, if you're in pain, you don't want to have to wait a long time to go see the physician, and you want it to be an easy process to get in and do. So really all of those things can give you a positive or negative view of the visit itself. So, let's start from the beginning with this. As far as what patients want, I want to be able to get in. I want to be able to get in quickly. I want it to be easy. Can I schedule online, or do I have to call in? If I call in to someone, do I have to navigate through a complicated phone tree, or can I get directly to a representative? Do I even talk to a person, or is it an automated system? And really, I want to know it's simple, and I want to know that it was effective when it was done. when I get there, I don't want to be sitting in the waiting room the entire time either. I want this to be fast. I want it to be easy. I want it to be convenient. And I want it to be on a day then that I can see the provider himself. So really, when we take a look at this, let's take a look at a dashboard, and we can really kind of delve into some of the things that lead to patient access issues.
Yeah, so what we're looking at here is a dashboard visualization that has multiple pages with some different metrics. And some of the core things that, I like to look at when I think about what's going on with patient access is, are we having a lot of bumped appointments, for example? Are the physicians having to cancel appointments due to surgery, or, even COVID, has caused a lot of issues with staff and timing? Do we look at our volumes by day? And I think this is pretty typical in most practices. You'll see that Mondays and Tuesdays are really the busiest day of the week. And maybe we're even stretched a little bit over capacity, and that might be increasing our wait times. And of course, depending upon what scheduling system you're using, we can measure those wait times and be able to look at what's going on with different physicians, different clinics, and different locations on different days. So, some of the core things. And then, of course, if we look at sort of what I call traditional capacity metrics, are physicians double booked or overbooked, or are they underutilized? And we can very quickly start to see which physicians are, fairly tight in their schedules and their available time. And we can even focus in on which physicians have a long third next available, and then see how that's correlating to some of the other metrics on the screen here.
Yeah, I think it is important to look at those things. I think one of the things that I would look at in this, particularly if we're talking about balancing perceptions, are those that have maybe the low third next available. Because I think we can see from this that while it's possible to get them in, that's a reality of the system that's out there. Still, a lot of these are not getting in for more than 30 days. And so while they have these longer wait times that are out there, we have to really kind of question why that is. Is it because we're not available at times that are convenient to the patient? Is it because we're not necessarily utilizing our scheduling to the max availability, or our templates are not really being as efficient as they possibly can be? So looking at these things is really balancing these perceptions is what really helps us understand the difference between the reality of the system and what the patients are experiencing themselves. So once we get the appointment scheduled and we get in, we want to look at the other aspects that really kind of give that first impression of the patient experience. What happens when they walk through the door into your waiting room? Are they greeted warmly? Are people acting like they were expecting them? Are they given a mountain of paperwork to fill out? Is the waiting room clean, or is it crowded? Are they going to feel like they're not going to be able to be seen for quite a while? All of these really kind of feed into that perception of the visit that happens. And we want to make sure that with that, are we also communicating to them possibly, what their responsibility is going to be for the visit, and even giving them maybe an estimate of what we think in the end it's going to cost them to have their issue taken care of.
And then going a little further with that is, what about after the visit? When the bill shows up in the mail and they were told there wasn't going to be any balance due or anything. Patients don't like surprises. That can create stress. Even walking in and saying, well, you have a past due bill and maybe you didn't know about it. So the patient experience, even before they've seen a physician or a nurse, patients want it easy. They want to be able to get in. They want it convenient, and they really don't want any surprises. As we start to look at the data around that, or how we might compare what the patient is experiencing to what we think is going on, we can build out dashboards. We can bring in industry benchmarks. The HFMA has the map keys. MGMA has their survey data. And so we could build out a dashboard and kind of look at, what's our availability to see patients, or how many patients are able to be seen the same day they make the appointment. And so we can kind of try to benchmark ourselves to what the industry says is good or bad. But again, it may not be telling us the whole story.
Right, and these reports are really great. Again, our analytics are going to show us what's actually going on, but I heard a provider once that I worked with give a great quote where he said, "It doesn't even really matter what we think. Patient care isn't excellent unless the patient thinks it is." And so if we really want to understand where the patient's coming from, we can engage them directly. But I think in the end, the best way to look at that is really digging down into the patient surveys. So what we're going to do, we're going to go ahead and shut off our cameras here, and we're going to dig in and start looking at maybe some detail level information of, how we can best utilize the information that's coming back to us from our patient surveys.
Yeah, and this is kind of a fun visual dashboard. We certainly had some fun building it out. And what you're seeing here then is we've taken all of the patient survey data that we've collected, all the different questions, and then we've rolled it up and we've modeled it into a structure that not only can we do analysis within the data, but we can also join it to our other data sets. And so what you're looking at here is the overall division score. And because this is a fully interactive dashboard, right, I can just kind of click through very quickly, but you'll notice right away we see infectious disease has an overall the lowest score. So we're going to focus in on potentially what's going on in infectious disease. Over here on the right side of the screen, you can see we've got different physicians. We can fairly quickly just sort and start to see who are the bottom performing physicians on their provider score. And then we've added a couple of the other sort of questions, which are, would the patient recommend the provider, or would they recommend the practice? As we go further down, you can see here's the overall survey rating. These are by physician, so we can even just sort of pick through and pick the lower physicians on the scale. And then you'll see we've added to the bottom here, how do they feel about the care team with those questions? How do they feel about staff coordination of care? You can start to see, again, there's a few lower outliers here.
Yeah, I think when you look at this, you can look at that care team and you can see that, overall, those are some pretty high scores with regard to the care team. So it sounds like it looks like they're pretty satisfied with what's going on there. But if you look, the scores are much, much lower on the access to provider there. And so when we look at that overall access score, and we can see how it's probably impacting the overall provider score on those axes below, really you can dig in now and see that, okay, there's probably an access issue in this clinic that we need to work to solve, not just to get better access, but also to impact our patient experience and our patient satisfaction scores.
So around that, we actually built out another page, depending upon how you like to look at the data. So this is the next level down. We're looking at the overall provider score. I'm just going to filter out the CAPS data, so we're just looking at the survey data. And then as Scott mentioned, we could look right at the access scores, and we're actually seeing the questions here, and I can sort. So we've already sorted and looked through. And if I just click through at timeliness of visit, just for one particular area, you can start to see which questions, were you informed of delays? What was your wait time? Were you happy? And you can right away start to see, where are there survey questions and where the data is sort of pointing to the areas we want to focus. What's interesting is, I've been doing analytics for 20 plus years here at PDS. And so when I first said, well, now that we have all this data, I like to look at it in sort of the more traditional cube, slice, and dice format. So I first said, well, this is how I want to see it. And then we went and built out that dashboard. But another way to look at the data, this is a fully relational cube. So you can see I have the same, this is the data behind that dashboard. And I can look and see the different questions. So if we want to look at timeliness of visit, and then I just want to bring in all the providers, and of course, when I'm filtered on infectious disease, I can very quickly just sort right through, change my filter, and we can start to see that Chris Covington has some of the lowest scores for timeliness of visit. And, Roderick Wilson that we saw on that other page also, some challenges here. So it's kind of interesting whether you're, used to looking at it one way or you want to look at it another way, if you're more into the data. From this point in our dashboard, because we've modeled the actual survey questions, you could even drill all the way down to the individual survey data if that data is available through the data set we've modeled. So kind of different perspectives, but to give you access to, depending upon how you want to see it or how you want to share it, which leads us into the next piece, which is if you've modeled out your survey data and you want to be able to communicate to a physician or the care team, the 4 or 5, 6 metrics where you have performance opportunities where maybe the patients aren't rating you very highly, You then, with your analytics, you can sort of present the data in a more visual fashion to make it easier and for the audience to understand what are the challenges and what are we trying to accomplish.
Yeah, so the thing I like about dashboards like that is that, it narrows it down so that you don't have every single question going out to every single provider. You can narrow it down to 4 or 5 different more manageable metrics that the provider can look at and quickly see the trends and things like that, so that they can really start focusing in on areas where they maybe need to spend most of their time. I think one of the reasons why we really care about getting down to this level of detail is because, when we think about it, dissatisfied patients are going to talk about it. I think we learned about it in business school. They talk about a dissatisfied customer will tell 10 other people, where a satisfied customer probably isn't going to say anything about it. Or if they do, a satisfied customer is only going to tell about half as many people as a dissatisfied customer. And when you talk about social media with, Facebook, Twitter, etc., you're really, you have 200, 300 Facebook friends, you have 1,500 Twitter followers, whatever. Really, that message just gets out much more quickly, and so we want to really work to solve our patients' problems quickly when they have that, and make sure that that's not getting out, especially when we are having, like we said, good outcomes, which are feeding in, but really getting kind of thrown off by little miscommunications here or there.
Yeah. So let's talk about some other data points that might be of use when we start to think about, if we're having, patient dissatisfaction, maybe it's with the staff or care teams. Some of the areas that you might want to look at your data on is something like your human resources data, where you might want to be looking at, have we had a lot of employee turnover? Or, even our own employee satisfaction surveys, maybe we're seeing some fairly low satisfaction, or that we've had to take disciplinary actions. Maybe we're having some challenges with staff that need to be addressed that could be impacting things. Another key area or data set you might want to look at is, your staffing metrics. Maybe we have a lot of employees working overtime. COVID has really strained healthcare practices, and so maybe we have a lot of staff outages, and so therefore we have a lot of employees working overtime, and that could be stressing. And maybe we just don't have the right staff to clinical ratios to really understand, to be able to treat the patient appropriately, which has really been some of the challenges we've seen with COVID in particular.
Yeah, and I think you look at that and you can see, obviously our staff is a big part of the equation. Also, technology and processes can be part of the equation as far as what our patients are dealing with. Particularly, you work in a call center, because that's way patients are going to reach us, both to schedule an appointment as well as to maybe do some registration or refill prescriptions, or even when you look at it to pay your bill, making it convenient. And again, a lot of times it's going to be frustrating when you have to navigate a complicated phone tree, or if you have to wait on hold a long time. Or really, a lot of times people, they just want to talk to someone. They're confused, they're upset. They just want to talk to someone, and sometimes that technology can really kind of throw them for a loop from an experience standpoint.
Yeah, when I like to dig into call center data and sort of mine that data, one of the metrics I really like to focus on is the abandoned call rate, right? So a bigger organization that has data that can be mined out of their phone switch, really understanding how many patients gave up, didn't ever get to where they wanted to go or didn't get resolved, and then they abandoned the calls. And then, the other piece, as we talked about, is if you have your data modeled, right? So being able to measure the patient satisfaction and put that right in with your call center stats if and or appropriate. Okay. I'd like to come back to one area in particular, Scott. We talked about patient outcomes and how patients want positive outcomes, but I really feel there's a segment of the patients that potentially have a different need, and that's patients with chronic conditions that really need a different level of management care, assistance with scheduling, and those kind of things. So can we focus back on that area for a minute, Scott?
Yeah, actually, this is something that I myself personally can speak to, where a few years ago, I went in with what I thought was just a little pain that I wanted to have them take a look at, and it turned out that there was a chronic condition that needed to be managed. And with that, I became a huge satisfier to me with the clinic that I was working with, in terms of, from that point on, members of the care team would reach out to me periodically, just to see how I was doing, discuss if I needed any tweaks in my medication, really kind of make sure that things were going well, and then of course try to get me in more proactively to make sure that I was following up on my care and that I was being compliant on my side. It leads to good outcomes, but in addition to that, it really makes me feel cared for and seen as an individual rather than as just kind of one of the patients in the practice.
So this is an area, I'd be remiss if I didn't bring it up, but in November, the last webinar that we held, we talked about blending metrics for practice wellness, and we specifically focused in on some of the different data points and metrics to really understand how well are we managing chronic condition patients, and what are some of the different areas and metrics that we want to focus on. So I thought we would take a minute and just look at one of those dashboards that kind of looks at one example of, are we making it easier for patients to have a good experience as we're managing their chronic conditions?
Yeah, and this is something where what we're looking at is, are we getting patients back in to manage their chronic care? We can look at it from a standpoint of when was the last time they were in just to see us, and are they getting annual wellness checks? So we can look and see who's past due for an appointment. We can focus in, if we want to, just on our high and moderate risk patients, but really what we want to understand, if they're past due, do they have an appointment scheduled? If they don't have an appointment scheduled, I'll tell you this, when we talk about ease of scheduling an appointment, if the staff is being proactive and reaching out to the patient rather than the other way around, again, it makes them feel cared for and seen as an individual. But as far as ease of scheduling an appointment, there's really no easier way than having the staff call you to schedule that appointment. So being proactive and managing the patient's care that way not only improves your loyalty, not only improves their satisfaction with the practice, it's going to improve their compliance, which is also going to improve their overall outcomes. Yeah.
So how do we tie some of this back together, kind of what we've shared today? So one of the key areas is, thinking about it from the patient's perception, and understanding what do patients need and what do they really want, right? And oftentimes that includes segregating your patients, right? So, patients with chronic conditions, maybe patients that are more elderly, may have very different needs than the younger population who might just have an acute condition they need to be seen, and they might want to be seen quickly. So it's really understanding what the patient needs are. And then, certainly if you're having challenges or you're getting negative feedback, engage the patients directly is really key as you change your process. And, I'd go further to say, gather feedback, not just in survey. If you're just relying on your survey data, you're probably not looking at the whole picture. So gather feedback in person, especially in the areas where you've been struggling. Maybe it's having the checkout person ask, how was your experience today? Or is there anything you might highlight, or share with us? So, really kind of asking questions and not just relying on the survey data is one area to think about.
Yeah, I think in addition to that, we really need to make sure that we're taking our management perspective and making it a little bit more patient-focused. A lot of you out there may be looking at strategic plans or marketing opportunities that are out there with regard to patient satisfaction scores. And I think when you're doing that, make sure that you're incorporating these patient experience into your marketing plans, into your strategic focus that's out there, and make sure that there's organizational buy-in. Make sure that when we're looking at it, we're not just looking at the financials, we're not just looking at volumes and productivities, but that patient satisfaction and patient experience is a metric that we're reporting and communicating back to the practice staff and management frequently. And then in addition to that, we have some business needs that we're looking at we need to make sure that we're balancing those with the patient needs, because overall it's going to make us better as a practice, both financially as well as from a growth and volume standpoint, if we have satisfied patients that are going to be loyal and going to be giving us good word of mouth advertising.
Yeah. And then, it seems a little silly for me to say this, but data, right, is important, because you all came to today's webinar, so I'm sure you understand the value of a data-driven organization. But, actively measure and manage your data, but also don't just rely on your data. As Scott pointed out, we might look and say, well, patients are complaining about access, but we know we have lots of access. Well, then why are they complaining? Maybe we don't have the right access. Maybe we're not accommodating their schedules or when they want to be seen. So very important to have data, and a variety of data that you can look at. And then, of course, having the right tools so that you can slice and dice through the data, or present the data, or publish the data. So where you've identified opportunities for improvement, you can get the right metrics in the hands of the right people the right way. And then, of course, thinking about an ROI, a lot of times people might say, well, we already spend money on surveys, we have some metrics, what's the real value of this? And going back to, can we tie an ROI to performance improvement? It may be a little bit tricky to directly manage an ROI, but I don't think anybody would disagree that patients who are very satisfied tend to be loyal patients. They tend to share the word, and a practice can really flourish when the practice is doing everything right to get us to where you want to go with the patient experience. This concludes our webinar today. I do want to thank everybody for joining us, and appreciate your interest in the topic. And we hope to hear from you or see you at future webinars coming up. So thank you so much for joining us today. Have a wonderful day.
Hey, thanks, everyone.